Hi, very good morning, all of you. Thanks a lot, Dr. Kishore, and thank you very much, Dr. Manohar, for the brief introduction and overview on what exactly we are doing at Royal Care Hospital. Well, I won't take much time of yours. Straight away jump into what exactly is the device that we are talking about. This is MR-guided focused ultrasound, which is a device wherein you make use of acoustic energy, focus it on a target inside the brain, which is identified with the help of image guidance of an MRI. So that's how the system works. It's two devices working in tandem. One is an exablade neuro device, which is the device just is executing and focusing acoustic energy and a 3 Tesla MRI. In our hospital, we use a 3 Tesla MRI, but there is nothing stopping users to make use of a 1.5 Tesla as well. This device was inaugurated in the month of Feb 2023, a little more than 3 years from now. We started our operation from August 2022 onwards. The device is actually manufactured by an Israeli company called Insightech, and which is fully held by GE Healthcare. And that's how very appropriately we invited the then ambassador of Israel in India, Nor Gilon, and he's the one that you see in the document. Now, the procedure, it's a teamwork between a radiologist, neurosurgeon, neuroradiologist, neurologist, as well as anesthetist. So the entire faculty is what you see here. At any given point of time for every procedure, we have a minimum of 2 neurologists, 2 neurosurgeons, radiologists, and an anesthetist who are always present. It is I would say, a futuristic device, which is knifeless neurosurgical system, approved by US FDA as well as Government of India. The first approval by US FDA was obtained more than about 14-15 years back, which was primarily for essential tremor. Subsequently, we received an FDA approval for the treatment of Parkinson as well. This is a small animation which I would like to show you on how the system works. In principle, most of you during your childhood, you would have used sun ray to focus on a piece of paper using a lens, and at the focal spot, the paper burns. Now, imagine you are replacing sun ray with acoustic energy. Instead of a lens, you are now making use of a ultrasonic transducer, and your target here is not the paper or the cloth piece, it's a brain, target inside the brain that is identified with the help of an MRI. What we are showing here is a tissue equivalent phantom material wherein sound energy is focused, and at a given point of time, an ablation happens. So that's how the treatment takes place. A brief the patient is taken inside an MR. This is a 3 Tesla MRI, and now you focus the acoustic energy onto the target, which is identified with the help of an MRI, and at the focal spot you will notice there is a ablation or necrotization or lesioning. In the language of medical science is how the device performs. And you have to clean shave the patient, head shave, primarily to avoid ultrasound to get obstructed, and now the patient is fitted inside a helmet shaped transducer. This transducer has, what I showed you earlier was one transducer, whereas here you have 1024 transducer element which focus the sound energy. You verify the target and you make the patient identify, because the patient is fully conscious, you verify the response of the patient by making him write, hold spoon, hold cup filled with water while the treatment is going on. That's the beauty of the procedure. And this would also give an information to the treating physician how well the treatment is progressing. It's a step-by-step process. You can imagine approximately 12 to 15 steps. And once the team is satisfied, you exceed the temperature beyond 50, wherein the actual lesion happens. Thank you so much. I would now request Dr. Senthil to explain to you in more detail about the clinical aspect of the MR guided focused ultrasound. Thank you so much.